If you've had some inflammatory response in your lung, that could impact on how you breathe when you lack control of your, for lack of a better word, your windpipe. So that may cause you to wake up at night, even without thinking about it, because your pulmonary system is just not what it used to be because it's affected by the previous infection.
There's something called long COVID too. Now, long COVID are symptoms that last post-COVID. And the lung is, as Dr. Anderson said, the lung is a component that is affected by COVID. I want to know, did you have family members that had, that had COVID and severe, and did you lose anybody during COVID? You did not. Okay, good. You think about anxiety as well, and it's just more than, you may be associating it with that particular time, but it may not truly be related. So that's one of the things you think about as well. What else could it be as well? Could it? Go ahead.
I run a healthcare clinic, so a lot of my, during that time, we were worried about people staying alive, staff,
Right.
Are they healthy? Somebody gonna die?
Right.
So that really did impact.
It impact you. Maybe you can address
I was gonna
that.
say, sometimes we take mental health for granted because all these things are supposed to be second nature. And
Right.
I'm just wondering if you being in leadership, you continue to have this lingering feeling of being responsible for everyone else around you while you're asleep.
Right.
So,
Yes.
But all these things are intertwined. We were talking about inflammatory responses. When we can't breathe, we get anxious. It's common sense. Well, it seems like common sense, but you wake up in a panic. You don't even know it because you're barely awake in that moment, but you are awake, so you're losing sleep in that moment. You love what you do, but you love the pressure. But pressure still is there. It's just how we manage it. And you might be managing it well, but you're just not letting off steam maybe in other ways because you might be hard on yourself. So there's just ways to kind of like bring insight to this and kind of move forward after that. But all of this is connected.
I think the other thing to point out with sleep, it's very complex, but just to kind of tie it into the urologist here, sometimes you may be waking up, I call it 20 million times at night to pee, that may be a sign of prostate issues, that may be a sign of obstructive sleep apnea, So I think our body just gives us signals, that we have to do something about it, and a lot of times, I heard it during the conversations, we ignore them, It's like the car, when you have that signal, you're really good about taking it to the mechanic and getting it checked, but us, we try to push the limits, and when you push the limits, that's when you start getting into trouble, So sleep is more complex than just, one thing. I think it's just a sign, that there's something else going on, and it's better to discuss it with your physician, and see exactly what the issue may be, you may be waking up 3-4 times at night to pee, hey, maybe you need to check your prostate, or maybe you need to get a sleep study like Dr. Anderson said, because it may be a sign of sleep apnea,
Those are some insightful comments. And I think since as a urologist, I'll just make a comment about that. Unfortunately, I've had patients come to me with complaints of loss of sleep because of nighttime urination. We refer to it as nocturia. And when we investigate it, and a number of occasions, what I detected was the fact that they were diabetics. And the reasons that they were going so frequently to the restroom was because they had developed diabetes, which was undiagnosed. And I think our internist raised an excellent point. He talks about, I used a sports analogy about the quarterback being, in this case, the internist. And they're the ones that basically can be the focus. We respond to their inquiries, their consultations. We assess the patients. We look for, maybe in my case, the urological components or the reasons that they may have certain symptoms. But they serve to gather all that information and make some sense out of it. And once I diagnosed or once I suspected diabetes, I send the patient back to the internist for the full workup and to make sure, again, if it's truly diabetes, it's well managed. the issue he raised about sleep apnea, another excellent point. So you need that quarterback to do the investigation as well, but to also correlate all that information that's coming from all of the specialists to make some sense of it and come up with an answer.
And well, no, we got a lot of questions, but sleep is important, and I just want to emphasize this. We have several stages of sleep, you know, stage 1, 2, 3, 4, but there's something called REM sleep, and REM sleep is that last stage, and if you don't hit that last stage of sleep several times a night, then you're not rested. Even though you slept all night long, you did not rest. So your rhythm, your circadian rhythm may be out. You know what I mean? At that time you're trying to go to sleep, your rhythm may be off now because you're just never hitting that REM sleep. So that's another thing you can think about as well, and when you talk to your internist.
Let's go. We go right here to this brother. Could you speak loud so we can hear you too?
Yes, absolutely. Can everybody hear me? Yes. My name is Quadia Porter. I run a small nonprofit, Northport Brothers Building a Better Nation. And my question was regarding healthcare access. So the National Institute of Health indicated that 40% of all emergency room visits can be managed by after-hours primary care services. And so my question is that, can you explain the differences between going to the emergency room and calling a doctor on call? And in what situations should patients opt in for one over the other? And so that's my question regarding healthcare access.
Yeah, that's a great question. Healthcare access and how best to use it. I think we have to do a better job educating and the communities about how best to use the healthcare system. I do see a lot of patients in the emergency department. The emergency department is open to everyone 24 hours a day, regardless of the situation. So whatever you feel is an emergency, you go to. But I think understanding your health and getting in front of it, seeing your primary care doctor, going for your annual visits, making sure you and your family use your birthday or the beginning of the year to schedule your annual visits, help you to get ahead of the situation and to develop a relationship with your physician. You should have a relationship with your physician where you can call him or her and have open discussions and send questions now via email or a call and leave a message so they could call you back. If they don't call you back, call them again. And so that's important that you do. But oftentimes, the emergency department seems like a very quick access. So if I go to the emergency department, I get all my labs, I get my CAT scan, I get my x-ray. And so that's the thinking with, I think often with people who go to the emergency department, they say unnecessarily so, but that's not the best way to address your health. And when you do go to the ER and I say follow up with your doctor, you need to follow up with your doctor. I know it seems like extra work, but calling your physician to schedule an appointment helps to get things in order. It's not a sort of one day solve all the issues. We have to take a few days. Sometimes we have to quarterback. We have to address medications to make sure that they're meeting the situation that is at hand. When it gets to become an emergency, when you're having, say, a heart attack or a stroke, that's because the chronic care, the addressing your medical issues was not done. And now we're at a place where it's an emergency and we're doing all that we need to do to try to save the life at that time. But I can't echo what you said enough. I spent my whole career trying to figure out how best to triage patients and say, or the community to say, okay, this is when you go to urgent care. This is when you call your family physician. This is when you go to the emergency department. And I think that healthcare access is important. But there is also the truth that we do have a underserved amount of physicians. We don't have enough physicians, I should say, rather, in the community that needs it the most. So we have to do better with increasing healthcare access and making sure we have more facilities, more doctors, more nurse practitioners, more physician assistants that's there to sort of address your needs right away, so you don't have to necessarily, I'm going to go to the emergency department because I have no other option.
And what's a doctor on call?
So the issue is more complex than it seems, right?
Yes.
And there are many reasons why folks go to the emergency room. An emergency room is exactly that. It's for emergency. It's not even for an urgent situation. It's for an emergency. I'm going to die in the next couple of hours. Now, yes. I'm going to die in the next couple of hours. Okay? What we're trying to address here is how to develop a pattern of health and wellness where screening is adequate, it's on schedule, and that's where your primary care physician is important. Now, why don't people have primary care physicians? It's complex than most of us think of. In urban centers, there are many people who are undocumented residents, right? There are many people who lack the appropriate insurances. One of the great things about Newark is what we call FQHC, Federally Qualified Health Centers, right? And Newark Community Health Centers is one such. And they're all over the place. And you, money or not, you can walk into any of these health centers. There are internists, there are gynecologists, there are dentists, all sort of specialists in these places. But, you know, Dr. Clark and I struggled the last month. I mean, really struggled. I take care of women with GYN cancers. 40% of my new cases came through the emergency room. They didn't just come through the emergency room. They came with advanced disease. Some of them, I just kind of threw my hands in the air and said, Kevin, what do you think? And he looked at me with this blank stare, like, what are we supposed to do, right? And when you look at these people, they're people who look like you and me, oftentimes from other places, right? And oftentimes they lack resources. But the lack of resources is not a reason not to see a primary care person, because these facilities do exist in this community.
Let me see your mic. Let me do something that is absolutely critical and important, and it has a lot to do with what they just stated. We have, and we probably should have emphasized this a whole lot more. We have Quest on site today, and we have what we call a blueprint for wellness. It is basically the drawing of the blood, and they take the blood and do the analysis on the blood, and you get a booklet that is sent back to you that breaks your blood all the way down and tell you exactly what's going on in your body. It breaks down the diabetic risk, it breaks down the cholesterol, it breaks down your kidney condition, it breaks down everything. It's one thing for us to have you in here today. It's another thing for us to empower you so that you become the manager, so that you become the guardian over your health and wellness, so that you will know what is going on in your body. We do not want you to leave here today without having this blueprint for wellness. And I'm just going to this is the kind of booklet that you get back, that they mail to you, Quest mail to you. But they cannot help you if you don't have your blood drawn. How many men in here know something about the blueprint for wellness and what has occurred? The blueprint for wellness have saved a lot of lives. We had several men in our congregation. Come on, we had several men in our congregation. Went to their doctor, did not pick up the fact that they had prostate cancer. When they took the blueprint for wellness and it came back, they discovered that they had prostate cancer, and they were able to catch it. Prostate cancer, I'm not a physician, but prostate cancer can be, quote, helped if you catch it in advance. We would love for you not to have it by getting your physicals and all of that. So right now, we have Quest in there. If you are here today and you have not had a blueprint for wellness, please stand now. If you're here today and you have not had the blueprint for wellness, please stand now. And if you have not had it, please stand. While we will give you food to take away today, every man will have a box. That's why we're telling everybody don't leave, because that food is going to therefore teach you. We're going to have a food demonstration. You will get another gift over there, major gift, when you get the blueprint for wellness. Listen to me carefully. I need at least 10 of you all right now who have not had this to please leave, because Quest need to draw your blood. Please go. I need you to go, because you need to leave here today getting the blueprint for wellness.